I'm Dr. Quintero here from HQ Dontics Miami. A lot of people are asking questions about what is a full mouth reconstruction. So today we're gonna dedicate a few minutes to answering some of those most common questions. So a full mouth reconstruction, like the word says, is basically recovering, rehabilitating the whole dentition, the upper and the lower dentition together to actually bring back the chewing ability and not just the cosmetics of it. If you are missing multiple teeth, if you have been grinding for a long time and you're noticing your teeth getting shorter and shorter, you might be a good candidate for a full mouth reconstruction. You can ask me any questions anytime. Just send us a message or call us at the office. We're here for you. There are many different treatment options when a full mouth reconstruction is needed. We can do it with crowns, inlays, implants, can be a denture, can be bridges. The important thing is that either the upper and the lower are restored all at the same time, which makes it complex, or one of the arches needs to be restored at one time. This is very important to keep control of the case. So technically, the only one that is qualified to do a full mouth reconstruction is a prosthodontist that has had proper training. General dentists with a lot of knowledge and a lot of experience in years learn eventually how to do a full mouth reconstructions without having to redo things. But again, you want to go to a specialist for this type of procedure. So the process of going through with a full mouth reconstruction can be very lengthy depending on what the treatment actually is needed. If implants are involved, if surgery is involved, usually will delay the treatment time, right? So anywhere from 1 year, 6 months to 1 year could be the time to complete a full mouth reconstruction, considering that all the things are done. In order to plan it, a lot of time needs to be used into properly planning a full mouth reconstruction. This is like an architect building a house. They need to spend a lot of time creating those plans and creating how everything is going to look and how everything is going to work even before they actually start doing anything. So this is the part where the knowledge and the training comes in. So every case is different. A full mouth reconstruction, like I said, can go from surgery, implants. There are a gamma of treatments that can be used in order to do a full mouth reconstruction. The important thing is that everybody is different. It can take 1 year, it can take 1.5 years. Sometimes it can even take 2 or 3 years to complete a full mouth reconstruction. The easier cases are usually going to be completed in 3 to 6 months. People ask me how long does it take to heal or to recover from a full mouth reconstruction. So typically, if there is no surgery, there is not going to be any pain in the post-op after you go home. It'll take about 2 to 3 hours to prepare one arch, and then 2 to 3 hours to prepare the other arch on a separate visit. The recovery is usually very easy and fast. Care that you need to consider after getting a full mouth reconstruction. Well, the basic thing is using a night guard. You want to protect your investment by wearing a night guard so you avoid breaking something at night if you clench or grind. The other important thing is taking your regular x-rays. Sometimes with a full mouth reconstruction, we are covering the whole of the tooth and we need to have x-rays to be able to see beyond that. So your regular checkups, your regular hygiene, and then your x-rays and your night guard. Unfortunately, dental insurances will not cover the cost of a full mouth reconstruction. Full mouth reconstruction is quite an expensive kind of treatment, and it involves a lot of time, a lot of effort, and insurances usually will not cover even for 1 crown. A question that is often asked is a full mouth reconstruction going to last for the rest of my life? And the answer is no. Nothing lasts forever. Everything needs maintenance, and you can extend the life of your restorations by coming regularly and finding things ahead of time so you can get them fixed. But nothing will last forever. Typically, a crown will last about 10 years. 10 to 15 years is the number that we like to give to a crown. A full mouth reconstruction can typically last 15 to 20 years.